If you are trying to conceive and you haven't been successful, I know that can be really difficult emotionally and disappointing. Today I'm going to cover the different guidelines we have of when to seek help and what we can do to support you in that journey. So for patients who are under 35 years old, is the inability to achieve a pregnancy after 12 months of regular unprotected intercourse. For patients who are over 35, that window narrows to 6 months, so it's 6 months of unprotected intercourse, and that's because those patients we want to see sooner. We're more likely to find a problem. We also want to help them sooner because time is of the essence. I also want to note that recently the American Society of Reproductive Medicine changed that definition to also include those that need to use donor sperm or donor eggs. They might be in a relationship where you don't have a male and a female partner. They might need donor gametes to build a family, and that also qualifies as infertility. It takes 4 things to get pregnant: a uterus, fallopian tubes that are open, ovaries that are releasing eggs, and sperm. If any of these things is not working, you might have an issue. So low sperm counts might be a problem. We always think about what might be going on with the woman, but sometimes people don't think that half of infertility can come from the male side as well. People that might be having irregular periods or no periods, likely they're not ovulating regularly, so that egg is not coming out at regular intervals. It can be really challenging to get pregnant there. Some people might have blocked tubes from prior infections or for no reason at all. Some people might have polyps or fibroids or other things that are affecting their fertility. So there's many reasons why things might have not been working, and the first step of helping someone on this journey is to try to understand, can we pinpoint a precise reason of why things aren't working so that we can help focus on that, or sometimes it just hasn't happened and it's something to do with age or reserve or something like that. If you're someone who's not having regular periods, definitely see us sooner. It's going to be challenging to get pregnant. If the male partner has had any sort of reproductive surgery, inguinal hernias, testicular issues, let us know. If you have a history of an ectopic pregnancy, if you have severe endometriosis, if you have any of these sort of issues that might affect your fertility, it's good to at least have a conversation up front. Many times for those patients, we offer them education and guidance, and they go and they try naturally and they get pregnant on their own. And that is the best case scenario. But oftentimes we pinpoint an issue that needs support or help correction with either medication or surgery, and we can offer that early before that patient goes through months or years of trying, oftentimes with very low likelihood of success. So we always like to have that educational conversation up front so we can guide our patients through that journey and then help them get pregnant, ideally naturally, sometimes with therapy if that's what's necessary. Every patient, every couple, and every fertility journey is unique. There's no one size fits all, and everybody is trying to achieve something different on a different timeline. Our goal is to help understand your timeline and what your goals are, and help you put in context what each of these factors mean. For some people is go home and try naturally. For others is you're not ready yet, but your fertility might be shorter, so let's save some eggs or embryos for the future. And for others is treatments to help you get pregnant as soon as possible. The first step in all of this is for us to meet you, understand your goals and your history, and help guide you on what the best way to build your family is.